I'm a doctor for people who are homeless. Early in my career, I noticed with alarm how my patients were always falling asleep. They'd fall asleep waiting to see me, fall asleep in the bathroom, sometimes fall asleep mid sentence while speaking with me. I would ask them if they'd maybe used a substance that was making them extra drowsy, and the majority of the time their answer was no. They were just so incredibly tired they could barely stay awake. Most people experiencing homelessness are in a constant state of profound sleep deprivation. I'm Dr. Jill Witchrock. When you're homeless, you are at an increased risk of being assaulted or robbed while you sleep. This is especially true for women and gender diverse individuals. People report having to sleep with one eye open in a constant state of hypervigilance. In fact, some of my unhoused patients use stimulants like crystal meth at night just so that they can keep themselves awake after dark and be less vulnerable to assault. When they do sleep, that hypervigilance rarely allows them to get into the restorative REM sleep that results in feeling well rested. But there are many more reasons why unhoused individuals experience chronic sleep deprivation. It can be really noisy, both when sleeping outdoors near traffic and when sleeping indoors in a crowded dorm room. Shelters also often have strict wake up time rules, so even if you didn't get to sleep until 3 a.m., you're forced to get up with everyone else and leave early in the morning. The weather plays a role as well when people sleep outside. It can be hard to sleep in the deep cold during a wind or rainstorm or in excessive heat. People rarely have something comfortable to sleep on, and if they do, it may end up being taken by bylaw officers in street sweeps. Sleeping on the hard ground makes for bad sleep as well as chronic pain, which in itself makes sleep difficult. People who are homeless also have high rates of mental health and substance use issues, and these both result in poor sleep. And another issue is something as simple as hunger. When people do not have enough food to eat, they sleep poorly. My patients report that they get the best sleep when they're in an environment that feels safe. Whether inside or outside, it's about where they feel the most secure. And when you don't have a space of your own, where you can retreat and lock the door behind you, it's very hard to feel safe and secure. So, chronic sleep deprivation is another invisible disability that affects every aspect of my patients' lives. It has a profound effect on mental health. It fuels substance use, affects memory, worsens chronic diseases, and can cause and worsen many other health issues. In fact, sleep deprivation is another one of the reasons why people who are chronically homeless live about 30 years less than the national average. As for my patients falling asleep when they come to see me, I've learned that this is because it's a place they feel safe, and that is a small gift that I always want to be able to offer my patients. When you see a person who looks homeless sleeping during the day, try to muster compassion instead of judgment. Remember that this might be the first decent sleep they've had in a long time. Be kind.